Welcome to Bat Therapy, mental health through the lens of comics and film. Be a fly on the wall or a bat in the cave, listening in on a friendship built out of a love for talking Batman, comics, and the everyday struggle to achieve mental health and happiness.
We're your hosts, clinical psychologist Dr. Amelia Brown and educator and comic aficionado Keaton Hopkins. Don't forget to follow us on YouTube and social media and find our Patreon at patreon.com/battherapy.
This podcast is about providing education and understanding and is not a replacement for mental health treatment or support. If you're needing help, go to bat-therapy.com for resources. Okay, so we're going to zoom in psychologically a little bit closer on Fantastic Four. So I was trying to figure out what might be a good topic with this. And so when we recorded about the Fantastic Four movie last week, I made a little bit of a comment that I was like, I want to go down this rabbit hole and look and see what I find.
Okay.
I don't remember why I brought it up, but I made a quick mention that Reed or Mr. potentially could be autistic spectrum.
Okay.
And so I was like, what do people say about this? So I went and I searched about it. So I thought this would be like a good opportunity to talk about autism or autistic spectrum disorder and what his character. So essentially his character, I think, creates this interesting question of, with Dr. Reed Richards, obviously he's this super smart guy. Very, very smart. And so when is someone smart and maybe quirky because of their intellect versus when might someone have autism, how, all that good stuff. So that's what I thought we would talk about.
All right. I already have a question for you. All right. So autism, it is actually considered a disorder.
Okay. So great question. In talking about autism, for people who are listening in, one of the things to be mindful about, one of the things to be aware about is that my knowledge base with autism is through mental health. It is a diagnosis within our DSM or what our diagnostic manual is. It has changed a bit over time. So like the DSM-4, the previous version had autism spectrum or autism and Asperger's syndrome separate. And so autism spectrum disorder, the reason they have spectrum as in the name is to highlight how there's very strong variations. It's so broad. You can have someone who is completely nonverbal, really struggles to communicate, has difficulties with getting their basic needs met without a lot of support. Or you can have someone where you don't realize they have autism unless they tell you. So it can really, really range and vary all the way in between. So
I already have my next question whenever you're done with that one.
Yeah.
Lots of questions.
You started with the big questions.
Sorry.
No, these are really important questions. So here's the thing. And actually, I think we hit on this a little bit when we talked about Full Metal Alchemist and we were talking about disability and disability representation. What is disability? What is a disability? What is a diagnosis? What is a disorder? What is what is normal variation in human beings versus what is a symptom of a disorder or a diagnosis or we usually don't say disease in mental health, but and so it's a lot more obvious when you have something like schizophrenia, bipolar disorder, depression, where you have these symptoms or things that group together and cause a lot of distress, dysfunction, whatnot. So this is a neurodevelopmental delay or a neurodevelopmental diagnosis, I should say. So it's something that happens, you pick up on it from the get-go. So you might not see it for a few years, or sometimes it takes a while to notice all of the pieces, but autism is one of those things that it doesn't just like appear when you're 18. It's something that is seen as like a developmental process before a person's even born. So genetics, environment for the fetus, potentially maybe very, very early environmental, but mainly prenatal and genetic kind of stuff. So the tricky thing is there's actually a lot of folks who, with autism, who say, hey, there's nothing wrong with me. I'm just different than the average. And
Right.
so there's a question of what when are differences just differences? And because you're different than the majority of people or how the structure of society is built, that difference is the problem. That difference is what causes the issue versus like cancer. No one's going to argue that cancer is something that is bad and you want to get rid of.
Right.
Some mental health stuff's more complicated. So, really great, complicated question. Honestly, different people are going to say different things. So, the role that we have as providers is to help someone who has autism spectrum disorder be able to function as best they can,
Hmm.
including just helping with. So some people can function pretty well, but there's a lot of anxiety and stress that comes with that because they're
Right.
masking, they're trying to pull off being like everyone else.
Hmm.
There are other folks that there's so much of the different components of autism to such an extreme where they're needing help just with baseline functioning. But our job
Hmm.
is to help people function as best they can to have quality of life. And it is something to just be aware of, where especially folks that are moderate or higher functioning, able to maneuver society, shall we say, better, might not see it as a disorder
Yes.
and being open to that idea.
Right. So my next question, because yeah, what you said does make sense. My next question is the word spectrum. That saying that people that are diagnosed with autism are all on that spectrum, or is it saying everyone is
Mm,
on a spectrum and falls somewhere on it? Right? Like, is there
a really
a
great question.
part?
So,
Yeah.
I think what you're asking is what spectrum are we talking about? Are we talking about like just people with autism of some sort and that's the spectrum, or is it everybody?
Right.
So, that's a great question. I honestly don't know what they intended in terms of what spectrum they're looking at. Usually what they're trying to highlight is I think what you're getting at here, which is the fact that any trait, condition, characteristic has a spectrum of variability in terms of people having whatever that is.
Right. Like minimal
And
to severity, like that kind of right.
yeah, low to high. So when they say autism spectrum disorder, what they're saying is that someone is having distress or trouble functioning in their life due to the components of what we see as autism. So we're talking about like social communication interaction difficulties. We're talking about also having either behaviors or interests or some sort of activities that are like very rigid and repetitive.
Hmm.
So sometimes you might actually see physical movements that a person might have, or someone might have just really focused interests and they struggle to talk about things outside of what those interest areas are, or they keep coming back to it in a way that can kind of make it difficult to maneuver situations that don't focus on those interest topics.
Hmm.
Are just two examples. And then the social piece, one of the ones we think of is like low eye contact. That doesn't necessarily have to be there, especially if someone's um,
Right.
kind of functioning more highly on the spectrum here.
Hmm.
But trouble with communication, understanding how other people are maneuvered a lot of times, being more concrete and literal with other people, struggling with the grays. There's a lot of gray areas or
Hmm.
social norms that bend and really struggling with a lot of those things, having trouble reading people's facial expressions or how they might be feeling, that sort of thing. A lot of times with kids, you start picking up on it because there's a certain developmental point where you expect kids to start playing with each other and showing interest in each other,
Hmm.
but you still see a lot of playing separately and independently, and you don't really get those interactions building up like you would expect.
Okay.
So those are the things you see with autism. How much that's there is how you look at the severity level in terms of autism spectrum disorder. So you hit a good point here. Some people listening might be like, oh, some of this sounds kind of like me. I'm doing okay. I'm not really, it's not causing any problems anywhere. Or, it might be a little awkward here or there, but, whatever.
Hmm.
Um, there are people who have some of these kinds of characteristics, but don't necessarily have autism.
Okay.
Um, so, like for example, let's take Reed Richards. So, let's talk about Mr. Fantastic. So, what's interesting is there's actually a comic in which he self-diagnoses himself with mild autism, I think is how he puts it. And then he says like, "And I'm creating a cure for it," and blah blah blah, which I'm sure a lot of people with autism probably didn't love that was his reaction to it, but
Hmm.
because not everyone sees it as something to cure. So there has actually been mention in the comics, and there's actually been quite a bit of discussion about the recent movie. And I wasn't the only one that when Pedro Pascal was doing things, I was like, huh, I wonder if he might kind of fall in that category. He gets very rigidly focused, like with his baby, for example, and loses
Hmm.
track of everything else. And like, what if this baby turns out to have like an issue and gets like hyper focused? There's definitely suggestions that he and his wife might have some like difficulties when he's just kind of being a little extra.
Hmm.
She at one point talked about how like sometimes him being himself hurts her. So we don't know the details of that, but there are just like certain things that suggest like, hey, there's something about how he maneuvers the world that can make things
Hmm.
difficult. The question is it autism, or is it his potentially the fact that he has this really high intellect? And so like a lot of like science bookish kind of intellect. Emotional intelligence, it seems like it's a different kind of intellect, right? And so
Hmm.
that one he might struggle with a little bit. But the tricky thing is so not being interested in playing with other kids or like interacting with other people. That can be due to autism where there are changes in the brain just related to your ability to be interested in connecting with other people or your ability to connect with other people. But a lot of people with high intellect, they're having trouble finding people that they can talk to in the way that they're
They
used to.
want.
Right. And so they have the ability to talk to people, but it's more just where they're putting their emphasis. Or they might become hyper focused and they might so a lot of times there's sensory sensitivity that both can have. So
Hmm.
with autism, people might have discomfort with certain textures or like with clothing or food or other things. With high intelligence, you might be picking up on a lot of like sensory type stuff, and that's part of putting everything together, but it doesn't tend to usually be quite as like triggering for someone.
Hmm.
Um, but you can be hyper attuned to things, you can get really focused. You tend to not see as much of the inflexibility with the high intellect versus autism, but there's actually like a ton of overlap where it can be hard to suss out like, okay, what's going on here? And you can have both. You can
Hmm.
both have high intellect and be on the autism spectrum. So it's definitely interesting trying to suss out like, okay, what is autism? And then also like at times too, like how important is this to put a label on it versus just saying, okay, this person,
Yeah.
in terms of how the brain works a little different. How do we make sure that they're still able to live the life that they want to?
Yeah. Because I will say that I'll be honest, there's so much that I don't understand about autism because part of it is media portrayal, right? Like the first time I ever heard about autism was because of the movie Rain Man.
Mm,
And he is like clearly like he has difficulties when it comes to mentally functioning. However, he is just absolutely brilliant when it comes to math.
the
He is
savant thing.
right.
Yeah. Yeah.
Yes, and that was the first time I ever saw like, okay, so that's what it is. And I saw it as like, okay, so he has difficulty with some things mentally, but he's also has a superpower in the
Right.
sense
Yep.
and I mean that does exist, I guess, somewhere on this spectrum. But I think also what ended up happening was, and I think this is partially due to social media, I have seen dozens of people self-diagnose themselves as on the spectrum. And so that's where my original question came from, like, hey, is everyone somewhere on this spectrum from
So
very likely not to yes, definitely, because people just got on social media and started saying, yeah, I'm on the spectrum or I'm autistic. The same way that like people say, oh, I'm OCD. And it's like, okay, but have you been to a doctor and gotten diagnosed with that? Or are you just saying
self-diag
that because
yes.
you relate to someone on Big Bang Theory, right? Like
Se
it's
Big Bang Theory. God, I love that show. So, self-diagnosis can be tricky. So, look, who of us has not Googled things that you experience and tried to figure out what it was? So self-diagnosis can be a really helpful part of the process, and it can also be a very harmful part of the process, depending on what's happening. So, and autism's particularly tricky right now. We have people who, based on their jobs, look like they are legitimate sources of information about autism and are spreading very inaccurate information. Unfortunately, there was research done by someone who not only did very poor research, but fraudulent research around autism and started this whole idea of or maybe perpetuated in a way that made it stick this idea that autism is caused by vaccines.
yeah.
And so this is just one example of a number of look, the thing is that people want to understand and they want to be able to figure out, okay, how do we work with these things to help someone live as best they can? And so it's coming from a good place, but unfortunately there is a lot of incorrect information out there specifically around autism. There have also been really horrendous statements made suggesting that people with autism are incapable of being members of society that we should value, which is not okay. So there's just a lot autism, man, it's been getting a lot of time out in social media, on the news, etc., not in helpful ways in a lot of it, unfortunately. So a lot of people with autism do not have this like savant nature that you're talking about, but that's what the movies love. The movies are gonna find, they're gonna try and find the like juiciest version of things. That being said, though, a lot of people with autism, especially if they're able to find ways to communicate, because remember that can really vary how well a person's able to communicate with others. But when you have a very focused interest, you tend to learn a lot about it. And so
Mhm.
you will, yeah, plenty of people with autism, whatever their interest might be, can tell you a lot about it. And it's actually really cool and interesting. And, just because someone has autism doesn't mean it's someone that you don't want to talk to or you don't want to be around. Sure,
Mhm.
higher
No.
likelihood that they're quirky and, the conversation might flow differently than the average conversation, but who cares if it's still,
Right.
fun and interesting.
Well, yeah,
Um,
and
but yeah, there are so they've identified a number of different genes connected to autism. Now, it does seem like there are different versions, so like different genes connected to different there's probably more layers to autism. There's a lot with anything that's in the DSM, anything that is connected to mental health in any way.
mhm,
Um, there's there's so much we don't know. So a lot of times there's really high chances that we're grouping together things that express themselves similarly, but they might actually technically come from different places or have like slightly like different genes in this case, but getting you to the
mhm,
same place. Interestingly, which I did not know this, and unfortunately, given the rumors around vaccines, they actually found that, gosh, was it measles? I'm forgetting now. But there was actually one virus that they found that if the mother had been infected with that virus, the child was much more likely to have expression of autism later,
and
which
that was good research or
this was good. This was quality research. So
okay.
here's the unfortunate thing is that if we become overly cautious about using vaccines because we're afraid of what vaccines might do, we might actually encourage increases in a virus that is known to draw out autism. That doesn't mean anyone that gets a virus will get autism. A lot of these kinds of things are genes plus environment. But one of the environmental things can be there's more variable data when it comes to other viruses, but there's at least one virus where it's like, oh, yeah, there's actually seems to be a pretty strong tie here. And it's one of the ones where we have a vaccine for it, which is awesome. But yeah, there's unfortunately just like a lot of stuff out there that makes it hard to find. So getting back to your
So
question.
I'm just making sure I understand what you just
Yeah.
said right though. So they were saying there was a link between that virus, not the vaccine.
Yeah. So, when it comes to vaccines, one of the sad ironies about this is actually there's a lot of hit or miss data for a lot of different viruses, but rubella is a virus where they actually found that if a pregnant woman was ended up with rubella,
Mhm.
um, there was a higher likelihood that she would have a child that ended up with autism.
Okay.
And so, actually, some of this misinformation is actually working against one of the most solid things
Of
that we know about
course.
an environmental impacts that
Wow.
can happen because we literally have a vaccine that, whew, take out rubella. Nice. We don't have to worry
No
about
more
it anymore.
rubella. Right.
No more rubella. Well, unfortunately, because of and so there was this research that was fraudulent, to be clear,
Mhm.
and we've known for decades that it's fraudulent.
Apparently not
Um,
everyone.
well, here's what makes it tricky is that some kids seem to be on a trajectory that's neurodevelopmentally like the average.
Okay.
And then it's usually within, I think they said like a year or two, you see a reversal. You see this like shifting backward almost when it comes to social pieces. And I'm not sure if they fully understand why that happens, but we link things in our brains that happen around the same time. And so there were all these people saying, "Hey, my kid's getting vaccines." And all of a sudden, my kid that was like on this trajectory that seemed to be like socializing, doing whatever, and they're shifting backward. They're communicating less, they're connecting with people less, and they're trying to figure out what to tie that to.
Mhm.
And so, unfortunately, this kind of thing happens. It's kind of like, but there are all these erroneous correlations that happen in life. There's when ice cream sales go up, so do homicides. Well, it's because it's summer and let's just say heat doesn't help with anger.
Okay.
So you have just because things happen around the same time, or just because, around the same time people get vaccines, but people are desperate to understand.
Mhm.
And then that research took it and ran with it and all that stuff. But getting back to your original question about like the self diagnosis, one of the tricky things is that not all information is good information. So if a person is able to find the quality information that will help you be able to understand a condition and experience whatever it is and get the factual, okay, this is the quality stuff. A person's own personal experience is actually really helpful in being able to diagnose. I cannot diagnose someone without them being able to relate to the symptoms or the characteristics I'm trying to attach it to, right? We both have
Right.
to have like a joint understanding. And that's true for so many things, even medical diagnoses, because they'll ask you about your symptoms. I can't tell you them on time. Look, when you're pregnant and COVID has just happened, they send you a screener and they're asking you, are you short of breath? Yes, I'm pregnant. I have less lung capacity, but they mean it for COVID, right? So my experience plus their not expertise knowledge together is important in order to figure out, do I have COVID or am I pregnant? Because of like the shortness of breath, right? So so there's nothing wrong with looking into the information yourself, trying to find what fits for you. But I agree with you. It's really important to also connect with an expert, with a provider, someone who can help you maneuver it a little bit more. Because
Mhm.
one, like I was saying, there's a flood of stuff out there about autism. And unfortunately, a lot of it is not great.
Right.
information. So just
Right.
making sure that you're getting the right quality information, one.
Mhm.
Two, when I pull out my DSM and I'm going through things and also I have a knowledge base on other things as well. I'm not just thinking about does this person match this one condition? I'm thinking about what are the other possibilities as well and what makes the most sense given this person's entire context. Right? Not just where we're essentially, like what does Sherlock say? You're essentially wanting your theories to match the facts instead of forcing the facts to match your theory. So it can be helpful to meet with someone so that you can talk step back and really look. So for example, is it intellectual difficulties or
Mhm.
intellectual high intellect? Could there be some sort of like schizophrenia type thing that runs in the family? Or are there learning disabilities or another neurodevelopmental condition? So talking to someone so that you can make sure to suss out, like, hey, is there anything I'm not considering that actually might be a better fit?
Mhm.
Um, and then also meeting with that person so okay, well, like, here's the thing, now what do I do about it?
Right.
So even if you're like, I know this is what it is. I'm really good at sussing out the right information. I'm not worried about like, going down the wrong rabbit hole. This is what it is. It still can be helpful to go and talk to someone so they can help you figure out, okay, so what do you want to do with this information? Where do you want to go with it? Is there anything that you're needing to help you maneuver this? Or is it just like it's helpful to know. For some people, it's just helpful to know. Other people, they can figure out, okay, so what are things that I'm struggling with
Mhm.
to maybe relate to other people? And is there a way that I can get treatment or figure out how to adapt my life in certain ways to make things easier for myself or whatever it might be? But yeah, the self-diagnosis, it happens a lot and it's not necessarily a bad thing. It's just autism is honestly a really, really great example where there's just so much information out there. It's easy to go down a rabbit
Mhm.
hole that might lead you somewhere that's not entirely helpful.
Yeah. Well, because and like I said, I think it's part of it's just media portrayal because I mean, I mentioned Big Bang Theory earlier. I've heard
Mhm.
Sheldon Cooper being talked about like it's being on the spectrum. Same thing with Abed from Community. Uh
Abed. Yeah.
yeah, as a matter of fact, I mean, I think in one of the episodes, Jeff Winger, like as an insult, says he has Asperger's. Um, and there was another superhero. It was Barry Allen, the Ezra Miller Barry
Oh.
Allen. I think I saw some
Mhm.
conversations about if he was on the spectrum or not. And so I think what is interesting is how thin of a line it is between they're somewhere on the spectrum versus they're just quirky because
Mm,
it's or just social being socially awkward, right? Or doesn't put
right,
someone on the spectrum, right? Especially
right,
if now we're saying that this spectrum is specifically for people diagnosed with this disorder,
right,
right?
right.
Um, yeah.
Yeah, you're hitting on a really great point. So I didn't find too much from like experts or providers or anything about Reed Richards.
Hmm.
But I did find, I like to look at the Reddits and
Hmm.
be careful going down those rabbit holes. But there's a
Very
lot of
careful.
interesting commentary people might have. And so a few people posted about it and I was looking at those and someone brought up your point, which is, yeah, how do we need to label everyone that's quirky as having autism and it is a really good point. So being socially awkward does not mean you have autism. Being quirky or feeling out of place does not mean you have autism.
Mm-hmm.
Um, it can be a sign that there's something going on that makes your brain function differently than other people. Your brain functioning different than other people doesn't mean that it's autism. I mean, like people with ADHD will talk about like my brain runs differently than other people and it makes some situations a little awkward and
Hmm.
so that's just one example. It's a really great point, and So one of the things too that's tricky with autism is there's also these increasing rates of diagnosing of autism, and I think that in some respects worries people. It depends, how you look at it.
Yeah, especially when something feels like it's a fad,
It
right?
can be tricky when yeah, I see what you mean by that.
Yeah.
One of the things with autism is there was a lot we didn't know about it. And so the more you know about something, the more you can catch it.
Hmm.
So there's a lot of that happening. Now there's also, yeah, there's tons we don't know about autism. I mean, there's lots of research going into autism. It's not like they're not trying to figure it out, but it's just
Hmm.
complicated. So, one of the things though that I think, there's sometimes just like push pulls in life where you almost like want opposing. You want like opposites.
Hmm.
And so on the one hand, we hate when people put us into a box. Don't act like you know me. Don't, treat me like a stereotype. Don't, any of that stuff. On the flip side, we want to understand. And if you feel out of place, you want to understand where that's coming from.
Hmm.
Sometimes getting a label can actually be so relieving.
Right.
It just helps you go, "Oh, finally all these pieces can be put together."
Right.
And so I think that with something like autism, it can be very tempting especially if you have felt out of sorts, to be able to find something that you can almost have as your North Star. So I know
Hmm.
I've worked with a number of people where they're like, oh, they realized in adulthood, they found out in adulthood that they had autism.
Hmm.
And now they have something they can search for. So they can look for videos for other people with autism, or look for, hey, how can I, like, it's hard to find information on something if you don't even know what to call it. So, I think that can be part of it too, is that one, we have more of an understanding of it. So a lot of people are realizing like, oh,
Hmm. Yeah.
uh, but also, I hear what you're saying. I think there can sometimes be a pull too, because if in some ways you belong to a club. I have other people that, okay, they're not the same as me, but they'll be able to relate and understand. And honestly, if you have autism or something else that makes you different, that's a rare feeling to get, and so something really precious. So, but that being said, like, yeah, it can be tricky to just kind of sort through a lot when a diagnosis, or when a condition, or when a trait becomes really popular out there. In some ways, it's
Hmm.
really great for getting education information out there, and then in other ways it can sometimes complicate it and make it harder to
Definitely.
tease things apart. But yeah, like
Yeah.
Richard Reed's, I think, is, or why do I keep doing that? Reed Richards. There we go. But yeah, Reed Richard, he so here's another interesting thing. So that can complicate it. There's a spectrum, but you're more likely to have lower intellectual levels if you have autism. However, that could potentially not be true, because there's also recent research to suggest that people with autism who essentially hide it better can maneuver through
Hmm.
society, like, you know, without standing out as much.
Right.
Um, unfortunately, they tend to have higher levels of anxiety. They also tend to have higher intellect than other people with autism. And so another thing to keep in mind is, say, let's take Reed Richards. Okay, so super highly intellectual person. A lot of people might just write it off as he's a super smart guy.
Right. That's right.
But,
Absolutely.
right? But could there be overlap with autism? There's enough to suggest, like, yeah, maybe it's possible. He'd be one to really hard. It'd be really hard to suss it out, because he's so smart.
He's very smart.
So smart.
He is like that level of smart where you start wanting to throw the word savant in there, right?
Mm.
Like the way that he just figures things out and he just understands things. It's too, and so that's why when you first told me, it was one of those things where my first question was, where is it? Because I don't know enough about it to even say like, oh yeah, he's definitely on spectrum or he's not, because it's watching it, like I said, I think like it seemed like he's just extremely smart, socially awkward. And in my mind, it's just that stereotype of lots of smart people are socially awkward because they spend too much time in the library and not enough time around people. Right?
So, that's actually a really great point where, they looked at Romanian orphans. So, I forget what decade it was, but
Okay.
they looked at children who were adopted from Romanian orphanages, which unfortunately, they were not getting a lot of attention. There was a lot of limited social interactions at this really young age for these kids. And they looked at, I think it was the UK. I don't know if maybe, like, a lot of people were adopting in the UK from there or what, but essentially, they looked at a bunch of these kids after they were adopted,
Hmm.
and I think it was, like, they looked at them around age 4, and then they looked at them around age 6. I might be getting those, like, specific details wrong, but it was around those ages,
Hmm.
and a number of them looked like they had autism. However, they saw improvements in those social abilities over those few years in
Okay.
that early age that suggested, okay, this is more of an environmental thing that is looking like autism rather than the neurodevelopment, i.e., differences in the brain that we expect. Now, the tricky thing is sometimes exposure, it like causes changes in the brain. But what we saw with these kids is if you change the environment, the brain was able to readjust what was happening internally versus with autism, you would not see those improvements and shifting more toward, they were essentially getting more toward what you would expect for that developmental stage.
Hmm.
Um, and so that's hitting on what you're talking about.
Okay.
So, one, intellect is something that if you're at an extreme anything at an extreme level, it's going to be hard to interact with people who are very far off from that level. It could be really hard to interact with them, it could be less interesting to interact with them, all sorts of things that once again creates some social disconnect that might seem autism like.
Hmm.
Um, and then also you're mentioning there might there might could be like self-selection that then furthers that difference where, hey, if someone is really about understanding and learning and finding things out, then they might just be internally motivated to just learn and learn and learn and learn and less likely to develop those social skills, just like these kids from the orphanage, where it's just more restricted social development because you're not exposed to it. And so that what you're hitting on, I think, is a really helpful and important piece of, okay, so what if this seems like it might have to do with like environmental factors after, the prenatal stage and like right after birth and that sort of thing.
Hmm.
Because remember, autism's starting early, early, early on. Versus what might have a different context that's explaining it, which would be very tricky. So with Reed Richards, you would ideally be able to talk to someone who was around during his childhood, also to him, obviously. So you'd want to talk to him, but
Hmm.
also ideally someone who could speak pretty directly to his childhood and those first early stages of life and that sort of thing.
Hmm.
Um, but yeah, it would, like you were saying, I mean, he's such an extreme when it comes to the intellect. I'm not sure if you could ever be 100% sure.
Right.
Because to be fair, like, look, you could be super intelligent and have autism. You can have both. So for him, it would be hard to like, because you can't just snap your fingers and say, okay, so for a few days, he's not going to have any of it. He's going to be average intelligence and let's see what his social connections are like. You can't just like snap your fingers and remove that whole piece. So honestly, for him, I feel like there would probably always be like some sort of a question mark about it.
And I'm not gonna lie to you. And this is coming specifically from a regular human being with zero background in this. If you told me that somebody had the ability to not need human interaction. Sounds like a superpower. Not gonna lie. I feel like this might just be the next step in human evolution. And it is one of those things like, yeah,
So, okay, first off, one thing I do want to clarify is just because, so autism, to be clear, I think sometimes there can be this misunderstanding where like autism doesn't mean you don't want to interact with people.
okay.
Uh, with high intellect, with autism, with a few different, you could have a disinterest, but it's much more about there being a disconnect and struggle with that. Interestingly though, there are people who say like, "Hey, what if we are the next step in evolution?" You tend to understand machines and mechanics and
Hmm.
some of those concrete things really well. Now, granted, keep in mind this is a spectrum. So when we're talking about people who comment about like, "Hey, don't put me in a box because of my autism," or "Hey, this is, don't treat this as like a problem," or da da da. Keep in mind these are folks who are able to effectively communicate to a certain extent.
Right.
There is a spectrum. So, like when I was in college, I actually, I forget what the title they gave me was, but I worked with someone with more severe autism,
Hmm.
very limited communication, was really only able to repeat words and statements from like favorite books and songs and things.
Hmm.
Um, just really had a lot. There can be such disconnect with communication that you actually don't know what a person is mentally capable of.
Hmm.
Um, and so, I do want to emphasize there is a spectrum here. And definitely there is a part of the spectrum where there are absolutely disability related things happening,
Hmm.
where a person's needing help to do basic needs and that sort of thing. However, when we're talking about the higher ends of the spectrum, there are people that say like, "Hey, maybe this is genetics trying something new, and who knows, maybe we might have trouble now, but technology's taken over and we love it." And once again, I don't want to group everyone together by any means, but I thought it was funny you mentioned that because I have come across that every now and then where it's like, well, are genetic changes necessarily a bad thing? Obviously there are ends of the spectrum, just like there are ends of the spectrum with height. You can be tall enough where it causes you a lot of problems. You actually live not as long if you're super tall. So, and I mean, there are disorders and diseases and whatnot that can cause, being very tall. And
Right.
sometimes you're just genetically really tall.
Right.
So, for argument's sake, I don't know. I don't know how it's going to turn out. But yeah, unfortunately, Keaton, it's not the magic sauce in terms of just not having to care about people and just living in a hole.
That, don't get it twisted. I love people.
Uh-huh.
Also, am like, I also feel like I just need to apologize for knowing so very little about this topic and having so many questions.
Why? I feel like that's the perfect way of doing this, right? Where
Yeah, fair, fair.
I mean, the thing is that if you have these questions, other people have these questions, and I definitely, for the record, always encourage people to check things out on your own. Be careful. This is unfortunately one of those scenarios where you can find bad information really quickly. But there's also a lot of really quality information. There's tons of research that's been done around autism. We'll have a link in the description that leads to one or two of those. But it can be hard to have the opportunity to ask these questions. And then what do you have to fall back on? Rain
True.
Man. And
Right.
look, there's nothing wrong with it. I mean, it's been a while since I've watched it. So
It's a
nothing
great movie.
from what
It's a
I
really good
recall.
movie.
Yeah, from what I recall, there's nothing wrong with Rain Man, but don't quote me because it's been a very long time since I've watched it. But that is one very, very specific example. And I think TV and movies are improving in some ways, especially television. Movies, you're going for gusto.
Mhm.
So sometimes you want really big examples of stuff. But I think we're getting better at looking at a variety and range of different people, including people with different like neurodevelopmental, mental health, et cetera, experiences. Thanks for nerding out with us. I'm clinical psychologist Dr. Amelia Brown.
And I'm educator and comic aficionado Keaton Hopkins. Check out my TV and movie reviews on YouTube at Team JVS. Check out our website at bat-therapy.com, our Bat Therapy YouTube channel, and follow us on social media. And don't forget our Patreon page at patreon.com/bat therapy. See you next week. Same bat time, same bat channel.